The heart is one of the most vital organs in the human body, yet it is also one of the most misunderstood. Over the years, countless myths have spread, influencing how people think about heart health. Some of these myths are harmless, but others could put your well-being at risk. Today we will separate fact from fiction and debunk 15 of the most common heart myths. Myth number 1. Heart disease only affects older people. While it is true that heart disease becomes more common with age, it can affect people of all ages. Young adults and even teenagers can develop heart issues due to poor diet, lack of exercise, smoking, or genetic factors. The early stages of heart disease, such as plaque buildup in arteries, can begin in childhood and progress silently for years without noticeable symptoms. Unhealthy lifestyle choices, including high sugar consumption, excessive fast food intake, and sedentary habits, contribute to the rising cases of heart disease in younger generations. That's why it's crucial to adopt heart-healthy habits as early as possible to reduce the risk later in life. Myth number 2. If you have no symptoms, your heart is healthy. Many heart conditions, including high blood pressure and early-stage heart disease, develop without noticeable symptoms. This makes heart disease particularly dangerous, as it can progress quietly until a serious event, such as a heart attack or stroke, occurs. A person can have blocked arteries, high cholesterol, or an irregular heartbeat without experiencing chest pain or shortness of breath. Regular checkups, blood pressure monitoring, and cholesterol tests are essential for detecting silent heart problems before they become life-threatening. The absence of symptoms does not guarantee a healthy heart, which is why preventative healthcare is so important. Myth number 3. A high-fat diet will cause heart disease. Not all fats are bad for your heart. In fact, healthy fats, such as those found in olive oil, nuts, and avocados, can support heart health and reduce inflammation. The real issue lies in trans fats and excessive consumption of saturated fats from processed foods, which can increase bad cholesterol, LDL, and contribute to artery blockage. However, unsaturated fats, like omega-3 fatty acids found in fish, actually help lower the risk of heart disease. The key is balance, eating a variety of whole foods with healthy fats while avoiding highly processed, fried, and artificially hydrogenated foods. Myth number 4. Heart attacks always cause chest pain. While chest pain is a common symptom of a heart attacks can present in many other ways, including jaw pain, nausea, excessive fatigue, and shortness of breath. Women, in particular, are more likely to experience non-traditional symptoms, such as pain in the back, neck, or shoulders, as well as unexplained dizziness or stomach discomfort. Many people dismiss these warning signs as indigestion or stress, delaying medical attention. Recognizing that heart attacks don't always cause severe chest pain can help save lives by prompting quicker responses to unusual symptoms. Myth number 5. If your heart rate is normal, your heart must be healthy. A normal heart rate does not necessarily mean your heart is in good condition. Heart health depends on various factors, including blood pressure, cholesterol levels, and overall cardiovascular fitness. Even with a normal resting heart rate, underlying issues like clogged arteries, high blood pressure, or arrhythmias can still exist. Heart disease can develop silently over time, and a person may not notice symptoms until the condition has progressed. Regular health screenings and lifestyle choices like exercise, a healthy diet, and stress management are critical for true heart health, beyond just monitoring heart rate. Myth number 6. Drinking red wine every day prevents heart disease. While some studies suggest moderate red wine consumption might have heart benefits, alcohol is not a guaranteed way to protect your heart. The antioxidants in red wine, like resveratrol, can be beneficial, but similar compounds are found in grapes, blueberries, and dark chocolate. Excessive alcohol intake, on the other hand, can raise blood pressure, contribute to obesity, and increase the risk of heart disease. Instead of relying on alcohol, focus on getting antioxidants from natural sources without the added risks of alcohol consumption. Myth number 7. If you exercise regularly, you won't get heart disease. Exercise is a great way to reduce the risk of heart disease, but it does not provide complete immunity. Other factors like genetics, diet, smoking, and stress levels play a role in heart health. Even active individuals can develop high cholesterol, hypertension, or arterial plaque buildup. While regular exercise strengthens the heart and improves circulation, it should be combined with other healthy habits, such as a nutritious diet and stress reduction for optimal heart health. Myth number 8. Taking an aspirin daily is safe for everyone. Daily aspirin therapy is not necessary for everyone and can even be harmful. While aspirin can reduce clot-related heart attacks in high-risk individuals, it also increases the risk of internal bleeding, especially in people without a prior history of heart disease. It should only be taken under a doctor's guidance, as unnecessary aspirin use can lead to complications such as stomach ulcers and hemorrhagic stroke. Myth number 9. Heart disease runs in my family, so I can't avoid it. While genetics play a role in heart disease, lifestyle choices have a greater impact. Having a family history of heart disease may increase your risk, but it does not make heart disease inevitable. Studies show that maintaining a healthy diet, exercising regularly, managing stress, and avoiding smoking can significantly lower the risk of developing heart conditions, even in individuals with a genetic predisposition. Myth number 10. You should avoid all salt to protect your heart. Your body needs sodium to function, but excessive salt intake can be harmful. Sodium plays a crucial role in nerve function and fluid balance. The real danger comes from high-sodium processed foods, which can lead to high blood pressure and increased heart disease risk. Instead of eliminating salt completely, focus on reducing processed foods and using natural sources of sodium in moderation, such as sea salt and potassium-rich foods like bananas. Myth number 11. Caffeine is bad for your heart. Moderate caffeine consumption is generally safe for most people and may even have heart benefits. Studies suggest that drinking coffee or tea in moderation may help lower the risk of heart disease by improving blood vessel function. However, excessive caffeine can cause heart palpitations and increase blood pressure in sensitive individuals. The key is moderation and being aware of how caffeine affects your body. Myth number 12. Stress only affects mental health, not the heart. Chronic stress can contribute to heart disease by increasing blood pressure and promoting inflammation. Stress triggers the release of cortisol and adrenaline, which over time can lead to hypertension and an increased risk of heart attacks. Managing stress through meditation, exercise, and social connections is crucial for overall cardiovascular health. Myth number 13. Diabetics are only at risk for blood sugar problems, not heart disease. Diabetes significantly increases the risk of heart disease. High blood sugar levels can damage blood vessels, increase cholesterol, and raise the likelihood of heart attacks and strokes. Proper management of blood sugar, along with a heart-healthy lifestyle, is essential for reducing cardiovascular risks. Myth number 14. Supplements like fish oil and garlic can replace medication. While some supplements have heart health benefits, they should not replace prescribed medications. Supplements can support heart health, but are not a substitute for proven medical treatments. Always consult a doctor before making changes to your medication regimen. Myth number 15. Once you have heart disease, you can't improve your heart health. Lifestyle changes and medical treatments can significantly improve heart health, even after a diagnosis. With proper diet, exercise, and medication, people with heart disease can slow its progression, reduce symptoms, and improve their quality of life. Understanding the truth about heart health is crucial for making informed decisions that can protect your well-being. Any of the myths surrounding heart disease come from outdated beliefs, misinformation, or oversimplified advice. While some myths may seem harmless, others can lead to serious health risks if followed blindly. Your heart is one of the most vital organs in your body, and taking care of it requires a well-rounded approach, one that includes a balanced diet, regular exercise, stress management, and routine medical checkups. Genetics may play a role, but your daily habits have the most significant impact on your heart's long-term health. By debunking these common heart myths, you now have the knowledge to take proactive steps toward a healthier heart. Stay informed, question health misconceptions, and always rely on science-backed information to guide your choices. A strong heart leads to a longer, healthier, and more fulfilling life. Don't forget to hit that like button and subscribe for more amazing facts.